one thing also you mentioned that I want to pick on is multimodality of data that a lot of people are trying to focus on right now. And again, that is one thing that even we as my research product that we are trying to incorporate. But one thing that I realize in many of the journal papers is when we try to do this multimodal deep learning models, when we try to build these models, a thing that gets introduced and which is highly debated, I would say, not researched as of now, but which is the introduction of bias in the data. So when I introduce these demographics data, for example your age, gender, demographics and other things, there is a high chance that machine learning models can get biased based on your, for example, the ethnicity or genders that is specific to person. So do you think that would be a problem from a medical standpoint? Because machine learning models just treat everyone as just bits or binary values. They don't understand the differences between biases. So do you think that is a problem? And if so, are there any ways that you have encountered which are trying to mitigate that? And if not, is it an open research question still?
Yeah, I think that's a pretty active area of research, and there's probably not too many like conclusive things that I can say. But if I had to go off and just comment a little bit, I think bias can be good and bad depending on how it's actually incorporated into the models. So, for example, in machine learning, we talk about having inductive biases built into our models that can actually add new information to the priors that we're trying to build out. So, for example, if we know, a recent, maybe I'll give a example here. We were trying to work with some CT scans and a patient's medical record data to predict risk of cardiovascular disease. We built a few models that worked only on images, and they worked pretty well. And then we built a few models that worked only on EMR data, and those worked pretty well. Obviously, the models that worked the best were that combined both of those, because the imaging has particular signs or markers of future cardiovascular disease. But at the same time, so does your medical record. For example, if you're male, you have a higher chance of cardiovascular disease as a baseline. So if we
Right.
actually add that as an inductive bias into our model, hopefully we can try to better solve that problem. So in that case, adding some medical information into what the model is using as a prior is beneficial. But I totally see the point that if we limit ourselves to small data sets that are not representative of where we would apply that model to, then the biases are not helpful. In fact, they might hurt patient because if our model is trained only on one ethnicity, and then we apply it to a different ethnicity, that ethnicity may have different risk factors for disease, different susceptibility factors. So I think at that point, that is an active area of research, and hopefully, maybe coming up with methods that are less intensive on the data needs may help generalize across demographics or across ethnicities. But I don't think that's necessarily been well studied, and it needs to be, because we are responsible for the patient's health and how they progress in the future. So before we deploy any algorithm at a large scale, we need to be able to characterize the performance, and we need to be able to characterize whether or not the behavior is really generalizable to the population that we expect to see at test time.
Right, right. And I agree. And I guess this brings to the same bottleneck of many of the deep learning models right now is like I love the statement that you said, like there are good biases and there are bad biases, because a lot of predictive classification happens based on those bias terms. But I guess this brings to the part that explainability and interpretability to understand what the model
Mhm.
is trying to learn, like what part of bias is really helpful, because I guess gender would be a very good classification even for human experts or medical experts who are humans. And yeah, I guess this brings to again the same bottleneck that only if
Mhm.
these black box models wouldn't be black box, things would be a lot more easier.